Hi, and welcome to the Conquer Fear page. Today we're going to be discussing the difference between fear and anxiety and exploring the various ways in which these emotions can impact our lives. We'll answer important questions such as, does anxiety cause fear, and how are anxiety and fear related? We'll also delve into the psychological differences between fear and anxiety and outline their respective symptoms. Lastly, we'll examine how these emotions relate to the broader concept of stress and look at the ways in which they overlap and differ. By the end of this video, you will have gained a comprehensive understanding of the complex emotional states of fear and anxiety and be better equipped to navigate them in your own life. So, let's get started. 1. Difference between fear and anxiety. With examples, fear and anxiety are two separate entities that are often intertwined. The differences between these two emotions lie in their triggers, the responses they elicit, and the duration of each. It can be useful for individuals to recognize the differences to better manage their emotions. One significant difference between fear and anxiety is their trigger. Fear is often triggered by a perceived danger, be it real or imagined. This stimulus is generally something that arouses an intense response in the body, such as the sound of an animal in the bushes while hiking. Here, fear is an appropriate response to perceived danger and elicits the fight or flight response in the body, releasing adrenaline to help us tackle the situation effectively. On the other hand, anxiety is an internal response to an impending threat that may not be definitively defined. It often goes on for longer periods of time and may be triggered by abstract thoughts and feelings. For instance, anxiety may be triggered by a child's first day of school. The child may worry about making friends, getting lost, or being bullied. These worries may persist long after the first day and may even escalate in severity as the child thinks about them. Here, anxiety is an inappropriate response to an event, and the feeling continues even if the event has passed. The responses of fear and anxiety also differ. Fear elicits an immediate response in the body to prepare for an immediate threat. It does not last long and tends to subside when individuals move away from the perceived danger. Anxiety also triggers the fight or flight response in the body, but the response is not immediate or as intense as with fear. Anxiety can often linger and generalize to situations that do not necessarily pose a significant risk. In terms of duration, fear is usually short-lived and ends once the individual has moved away from the danger. In contrast, anxiety can last for an extended period, even months or years, and may be a chronic issue. Anxiety can become a significant problem that interferes with an individual's daily lives and relationships. In summary, fear and anxiety are two separate emotions with distinct triggers, responses, and durations. Although the two emotions share characteristics and can be linked to one another, it is essential to recognize the differences to better manage them effectively. If anxiety or fear becomes overwhelming, it is important to seek professional counseling to manage these emotions. Through counseling and other forms of treatment, individuals can learn effective coping mechanisms to manage their symptoms and improve their overall well-being. 2. Does anxiety causes fear? It is also important to note that anxiety and fear can have negative impacts on an individual's physical and mental health if left unchecked. Chronic anxiety can lead to several physical symptoms, including high blood pressure, rapid heartbeat, headaches, and muscle tension. If anxiety persists for an extended period, it can lead to the development of anxiety disorders such as generalized anxiety disorder, obsessive-compulsive disorder, and panic disorder. Chronic fear can also have a significant impact on a person's mental health. Fear can lead to feelings of hopelessness, helplessness, and depression. In the most severe cases, fear can manifest as a phobia, a persistent and irrational fear of specific objects or situations. Recognizing the differences between anxiety and fear is the first step in managing these intense emotions. Still, it is also crucial to identify and address root causes and underlying conditions. For example, anxiety may be triggered by life stressors, medical conditions, or medication side effects. Identifying the underlying cause of anxiety and fear can help manage the symptoms effectively. In addition to seeking professional help, several other ways can help manage anxiety and fear. Meditation, mindfulness, and relaxation techniques have been shown to be effective in reducing anxiety and fear. Engaging in regular exercise and maintaining a healthy diet can also help reduce anxiety and fear symptoms while promoting overall health. In conclusion, the differences between anxiety and fear may seem subtle, but they are essential to understand for their effective management. Recognizing these differences can help individuals develop healthy coping mechanisms and improve their overall well-being. Seeking professional help and making lifestyle changes can also help individuals manage anxiety and fear symptoms effectively. Ultimately, with the right support, individuals can overcome anxiety and fear and lead a fulfilling life. 3. Difference between fear and anxiety in psychology. When someone experiences anxiety, the hippocampus can activate the amygdala, even if there is no immediate danger or threat. This can create a perpetual cycle of anxiety, where the brain is always on high alert and constantly looking for potential threats. In contrast, fear is a response to a specific perceived threat, such as an aggressive dog or a loud and sudden noise. Fear is a short-term emotion that typically subsides once the perceived threat has passed. Unlike anxiety, fear is not ongoing and does not have a generalized sense of unease. Another key difference between fear and anxiety is the physiological response they elicit. Fear is associated with a sudden and intense physical reaction, including increased heart rate, rapid breathing, and sweating. In contrast, anxiety typically produces a more diffuse set of symptoms, including restlessness, difficulty concentrating, and muscle tension. To manage anxiety effectively, it is important to understand the underlying causes and triggers. These may include life stressors, trauma, or underlying medical conditions. By identifying these factors, individuals can develop coping mechanisms to manage and reduce symptoms. Several therapies may support individuals dealing with anxiety or fear. Cognitive behavioral therapy, CBT for example, can teach individuals how to identify and challenge negative thoughts and beliefs that trigger anxiety or fear. Exposure therapy can also help individuals confront their fears gradually in a controlled environment, helping them develop the skills necessary to manage their response. Ultimately, understanding the differences between fear and anxiety is crucial for individuals to manage their symptoms effectively. By recognizing the underlying causes and developing effective coping strategies, individuals can manage and overcome these emotions to lead fulfilling lives. Professional help can be looked at to receive the necessary support to manage symptoms of anxiety and fear effectively. 4. Fear and anxiety symptoms. Fear and anxiety are emotions that are commonly experienced by everyone. These emotions can be caused by a variety of factors, including stress, traumatic experiences, genetic predisposition, or underlying medical conditions. When a person experiences fear, the sympathetic nervous system is activated, and the body responds with physical symptoms such as a rapid heart rate, sweating, and shaking. Fear can be helpful in dangerous situations as it triggers the body's fight or flight response, but it can also be debilitating when it lasts too long or is triggered by irrational fears. Anxiety, on the other hand, can be defined as a feeling of worry or unease about an event or situation with an uncertain outcome. The symptoms of anxiety can be both physical and psychological and may include excessive fear, worry, and a sense of impending doom. The physical symptoms associated with anxiety closely resemble those of fear, and because of this similarity, some people may use the terms interchangeably. In general, anxiety tends to be more persistent and pervasive than fear and less tied to specific triggers. Some people may experience symptoms of fear and anxiety simultaneously. The combination of these two emotions can lead to significant distress and interfere with daily life. For example, a person who is afraid of public speaking may also experience anxiety when in large groups or social situations. Managing fear and anxiety efficiently requires identifying the triggers that cause these emotions. Triggers can be either specific events or situations, such as the fear of failure, or it could be more generalized, such as feeling overwhelmed or anxious without a specific reason. Treatment for fear and anxiety will depend on the severity and duration of the symptoms. Some people can manage their symptoms by making lifestyle changes, such as reducing caffeine intake, getting regular exercise, and practicing relaxation techniques such as yoga or meditation. For others, professional help, such as therapy or medication, may be beneficial in managing their fear and anxiety. Therapeutic approaches such as cognitive behavioral therapy, CBT, exposure therapy, and mindfulness meditation can help individuals manage their symptoms effectively. CBT focuses on identifying and changing negative thought patterns and behaviors that contribute to anxiety and fear. Exposure therapy involves gradually exposing an individual to the feared object or situation in a controlled environment to desensitize them to the phobia. Mindfulness meditation involves paying attention to the present moment and developing a non-judgmental awareness of thoughts, feelings, and bodily sensations. In conclusion, fear and anxiety are normal emotions, but when they become persistent or impair a person's daily life, seeking professional help is necessary. With the right support and treatment, most people can manage their fear and anxiety and lead fulfilling lives. 5. How are anxiety and fear related? Individuals who experience anxiety may feel apprehensive or uneasy without necessarily being able to pinpoint what is causing these feelings. In contrast, fear is generally more directed and often has a specific cause or object that is causing the fear. Both fear and anxiety can have negative effects on mental and physical health if they persist too long or are not adequately managed. Chronic fear and anxiety can impair daily functioning, cause physical and mental exhaustion, and lead to more severe mental health issues such as depression or post-traumatic stress disorder. Anxiety and fear can be debilitating if not managed effectively, but there are several ways to manage and reduce their impact on daily life. One such strategy is cognitive and behavioral therapy. Cognitive and behavioral therapy, CBT, is a therapeutic approach that aims to help individuals identify and change negative thoughts and behaviors that contribute to their anxiety and fear. It is based on the understanding that the way people think about a situation or event affects their emotional and behavioral response to that situation. For example, if a person is afraid of public speaking, they may have negative thoughts such as, "I am going to mess up," or "people will judge me." These thoughts can trigger the body's stress response, leading to physical symptoms such as sweating, trembling, and difficulty breathing. In CBT, a therapist will help the individual identify these negative thoughts and teach them how to replace them with more positive and realistic thoughts. They may also teach relaxation techniques, such as deep breathing or visualization, to help manage the physical symptoms of anxiety and fear. Another approach to managing anxiety and fear is exposure therapy. Exposure therapy involves gradually exposing the individual to the object or situation that triggers their fear in a controlled environment. This approach helps them gradually become desensitized to the object or situation, reducing the fear response over time. For example, someone who is afraid of flying may be gradually exposed to airplanes in different scenarios, from simply looking at pictures of planes to being near them on the ground to taking short flights. Eventually, they may be able to fly without experiencing the same level of fear and anxiety. Mindfulness meditation is another therapeutic approach that can be effective in managing anxiety and fear. Mindfulness meditation involves paying attention to the present moment and developing a non-judgmental awareness of thoughts, feelings, and bodily sensations. This approach is particularly helpful for individuals who experience persistent anxiety or other mental health disorders. By learning to focus their minds on the present moment, individuals can become better equipped to manage their negative thoughts and emotions. They may also develop more effective coping mechanisms for managing their symptoms. In conclusion, anxiety and fear are closely related emotions that can have a profound impact on mental and physical well-being. Understanding the nature of these emotions and developing effective strategies for managing them is crucial for maintaining good mental health. Different therapeutic approaches such as cognitive and behavioral therapy, exposure therapy, and mindfulness meditation can be effective in managing these emotions, allowing individuals to live more fulfilling lives. 6. Anxiety versus fear versus stress. Stress, anxiety, and fear are complex emotional states that we encounter in our daily lives. While they may seem alike, they are different emotions that affect our physical, mental, and emotional well-being in different ways. Understanding and differentiating these emotions can help an individual cope better and be more self-aware in dealing with them. Stress is an emotional response to external stimuli that we perceive as taxing or demanding. It is often characterized by a sense of pressure or tension that arises from an overwhelming workload or a cluster of life events. Stress can cause physiological changes such as an elevated heart rate, sweating, and muscle tension. Prolonged stress can lead to mental health issues, such as anxiety and depression, as well as physical health issues such as high blood pressure and heart disease. Anxiety, on the other hand, is a heightened state of worry that often presents with nervousness, apprehension, and restlessness. It is a long-lasting and persistent feeling of unease, even when there isn't any external trigger present. Individuals with anxiety experience intrusive and obsessive thoughts, which can contribute to irrational behavior and an increased response to stress. Anxiety has a debilitating effect on an individual's life, impacting their ability to function in their day-to-day activities, ultimately affecting their quality of life. Fear is a response to an immediate or perceived threat. It is often characterized by an acute feeling of dread, accompanied by bodily changes such as increased heart rate and muscle tension. Fear is a necessary emotion that prepares the body for a survival response, also known as the fight or flight response. When experiencing fear, an individual is prompted to take action to avoid the perceived threat. For example, if you are hiking in the wild and see a snake, your fear response will prompt a flight response, where you either back away or run in the opposite direction. The effects of stress, anxiety, and fear on the body and mind can be detrimental. It is essential to learn how to deal with these emotions effectively. Mindfulness techniques such as meditation and yoga can help you manage stress and anxiety. These techniques teach individuals to become more self-aware and present in the moment, allowing them to cope better with the perpetual sense of worry and unease. Seeking the help of a mental health professional is also an option for those who feel that their emotions are debilitating and interfere with their daily functioning. A mental health professional can teach individuals coping mechanisms to manage stress, anxiety, and fear based on their unique situation. In summary, stress, anxiety, and fear are distinct emotional states with different causes and triggers. While they may seem the same, it is important to differentiate them to manage them effectively. Identifying triggers by using stress or anxiety tracking apps can significantly help you manage these emotions. Stress can be managed with time management techniques, anxiety with mindfulness and self-care, and fear requires prompt action to avoid the source of the perceived threat. Overcoming these emotional states can help individuals lead a more fulfilling and productive life. That concludes our discussion on fear and anxiety. We hope this video has provided you with a deeper understanding of these complex emotions and has equipped you with the tools you need to manage them effectively. This video was presented by Conquer Fears, and if you found this content helpful, we encourage you to subscribe to our channel for more informative videos like this one. Don't forget to like and comment on this video, as your feedback helps us to continue creating high-quality content. Thanks for watching, and we'll see you in the next video.